Good evening. I'd like to welcome you to the February meeting of the Pitt County Board of Health. I would like to go ahead and call the meeting to order. Are there any public statements tonight? We'd like to welcome a large group of students tonight. Where are you from?
East Carolina.
East Carolina, all right. I should have noticed those purple uniforms there. So, our first, hearing no public comments, our first order will be to go ahead and approve the minutes of the meeting from January the 12th. Those have been distributed in advance. Are there any corrections or additions to those minutes? Move to accept. But
Second.
Okay, second. Any further discussion? All in favor say aye. Aye. Any opposed? Okay, the minutes are approved. I'd like to move on to the fiscal report. John?
Mr. Chairman, board members, good evening. You have the January 31st financial report. I'll try to keep this report short. We have a lot on the agenda tonight, and quite frankly, the financial status really hasn't changed since our last meeting. If you look at the year-to-date actuals, we've brought in $5.4 million versus expenditures of about $5.123 million. That gives us a surplus of about $316,000. Once I take into account all the timing items, that surplus actually goes up to about $406,000. Mr. Chairman and board members, the only caveat I would say in that is that we still have 3 years of Medicaid cost settlement that is still under review, and that the ongoing dispute between the Department of Public Health and the North Carolina Division of Medical Assistance is still ongoing. While we've heard some positive chatter from the state health directors, we don't have anything definitive. I would just say that $406,000 surplus as of the end of January, that's really the best case scenario on those cost settlements. The worst case, as I've said before, could be a reversal of about a $1.2 million reversal. Again, nothing definitive coming out of the state on that. Cross our fingers and hope for the best.
Will that be decided this year, or you don't know?
We hope it will be decided in the next 30 days.
Okay.
Is what the chatter is, and we'll just have to wait and see.
Does anybody have any other questions for John?
Move to approve.
So move.
Any further discussion? So all in favor say aye. Aye. Any opposed? All right, the fiscal report is approved. Thank you, John.
And Mr. Chairman, just like to bring up on the budget, we are starting on the 2017 budget. That will be due in the county manager's office on March the 1st. So when we come back to our March meeting, I'll have the budget prepared for this board to review, accept, or modify, and we'll go from there. Thank you.
Very good. Thank you. Let's move on to old business, and we have several items tonight: the vision statement, the update on the agency values, and the agency action plan. So I think first is Amy Haddam is going to talk about the vision statement.
Good evening. I'm happy to be back with you to give you an update on our staff values listening sessions. They have been completed. We actually did the sessions November 2015 through early January. If you remember last month, we had 2 more sessions to conduct for makeup sessions for staff who had missed them, so we are now complete. And for our community's purpose, to let them know why we're doing these values, our staff values were originally adopted over 20 years ago. So during your retreat, the Board of Health retreat back in January of 2015, y'all did identify the need for us to revisit those values since it had been so long, and the fact that we do have new staff. And just to remind everybody of why we need values, the Pitt County Health Department's values serve as guidelines created and adopted by staff, which set the tone of the agency's work environment and motivate staff to perform according to their potential. Just a few logistics about how the sessions were conducted. Again, they were conducted from November 2015 through early January of this year, and there were 15 sessions that were conducted. Each session was about an hour and a half to 2 hours, and each session was strategically comprised of multiple disciplines to ensure that no one division or discipline monopolized the discussion. And there again, to ensure that all sessions were conducted in the same manner, the same staff did conduct those sessions. Myself, as well as Jennifer Hardy in our Health Education Division, and Allison Swart, also in our Health Education Division, assisted with the supervisor session. We're also very pleased that 97.5% of our staff participated. We got a lot of rich feedback from the majority of our staff. The mission statement. The mission statement has remained the same. So the mission of Pitt County Health Department is to protect, promote, and assure the health of all people in Pitt County. We protect people from environmental risks such as exposure to lead, foodborne diseases, waterborne diseases, and communicable diseases. We promote individual family and community health behaviors which maintain and or increase the span of a healthy life. And we assure and or advocate for access to essential preventive health services for all people. And our mission is accomplished through a commitment to quality, customer-centered services. And I do have to note here that staff have asked that we define customer because it's used several times throughout the values. So the term customer is used throughout the values definition and behaviors. Is defined as a patient, a professional partner, a community partner, it could be a student, volunteer, co-worker, or practically any individual for whom we're providing assistance or for providing a service. So it may be each other. As far as the vision statement, over 20 years ago, we developed a vision statement that reads as a community whose population demonstrates healthy behaviors and recognizes the health department as a leader and a valued partner in achieving and protecting the health of the community. Throughout the session, staff had asked that we update or revise the the vision statement to read as Pitt County Health Department visualizes a community whose population demonstrates healthy behaviors and recognizes Pitt County Health Department as a leader and a valued partner working to protect and improve the health of the community. So, Mr. Chairman, at this time, I'd like to ask if the board would like to take a vote on whether or not y'all accept the revised statement.
Okay, this statement, excuse me, is open for discussion.
I have none, so move.
I second it.
All right, any further discussion? If not, all in favor say aye.
Aye.
Any opposed, nay. All right, vision statement passes.
Okay, thank you. So moving on to the revised values. Values 1 through 5 were original values, and staff did vote to keep those. They were trustworthiness, customer-centered, teamwork, effective communication, professionalism, and then a new one, which is quality improvement. Now, each of y'all had the value statements emailed to y'all last week, and they were broken down with numerous behaviors. So what I'd like to do tonight is share with you and, of course, the public what those revised definitions of each one of these values are. And we will not have time to go in each one of the values because the behaviors, because that is so lengthy. So if you have any questions about any of those, then I'll be happy to answer those. But the first value is trustworthiness. The definition is trustworthy as being honest, fair, dependable, and handling all private information, whether it's written or verbal, with the utmost confidence. And there were 9 staff behaviors that describe this definition. The second value, customer-centered, the definition is assessing customers' needs and striving to provide services based on the needs identified by both customers and staff. And there were 13 staff behaviors that describe this definition. Value number 3, teamwork, working together to accomplish the same common goal. There were 10 staff behaviors that describe this definition. Value number 4, effective communication, the ability to clearly give and receive information in a manner that treats others with respect. 16 staff behaviors describe this definition. Value number 5, professionalism, serving customers with competence, integrity, and a positive attitude. 15 staff behaviors describe this one. And then the final, the newest one, is quality improvement, delivering public health services that are accessible, equitable, timely, efficient, safe, and evidence-based to meet the needs of our community. with 9 staff behaviors describing that one. So at this time, I'd like to ask if y'all could take a vote, Mr. Chairman, on whether or not to accept the new values as defined by the staff, the definitions, as well as the behaviors that y'all received last week describing each one of these new defined values.
All right, thank you, Amy. These are all open for discussion now.
I move that we accept them as presented.
Second.
It's been moved and seconded. Is there any further discussion or comments? All in favor say aye.
Aye.
Any opposed? All right, very good. Motion passes. These are very comprehensive. Will they be posted online for
Well,
public to see?
we will post the definitions, and we'll see if we have the room to post all of the actual behaviors.
Very good.
But we can make sure that any community member that would like to see them, that we can give them access to that. And I did want to leave you with a final note. Our mission, again, that Pitt County Health Department working together to protect, promote, and assure the health of all people in Pitt County. And at this time, if there's any more questions, I'd be happy to entertain those.
All right, thank you very much.
She's also going to introduce the agency action plan.
Okay, the next item is the agency action plan. And we have several presenters for different parts of this plan. Is that my understanding, or?
We do, and I'm going to start us off, and we'll switch presentations
Okay.
here. There you go. Okay, so the 2015 Pitt County Community Health Needs Assessment, this is our public health action plans that are presented, of course, to the Board of Health for the first time. Just to give you a background, especially for the community, I know each one of y'all are aware of why and how we have done the assessment, but just for our community purposes, that the Community Health Needs Assessment, what we usually call the CHNA, is conducted every 3 years to address the state of our county's health. And our most recent assessment was conducted in 2015, and it was very much a partnership between the Health Department, Vidant Medical Center, East Carolina University, and Pitt Partners for Health. Through this process, primary data were collected through community listening groups and through online community opinion survey. We had over 500 individuals to respond to that. Secondary data regarding the leading causes of death were collected, reviewed, and compared to data from Eastern North Carolina and compared to data over the United States. And our health priorities that we have selected to focus on for the next 3 years were aligned with North Carolina's 2020 health objectives. And public health's priority areas were selected by the Pitt County Board of Health, this board, and will be addressed through action plans over the next 3 years, and that's what we want to share with you now. The health priority areas that we'll be sharing with you tonight in the action plans, the first one is maternal and child health, focusing on infant mortality. Jennifer Hardy, who is our coordinator for women's and children's health education programs, will share that plan with you. And behind her will be tobacco prevention and control. Allison Swart, who is our health promotion coordinator, will share that plan. And then sexually transmitted diseases is the third priority area that was selected by this board. And Kimberly Hardy, who's our clinical services manager, will share that plan with you. So at this time, I'll turn it over to Jennifer Hardy.
Good evening. For our infant mortality prevention, the goal is to reduce Pitt County's infant mortality rate to at or below the state's rate, with special emphasis on reducing the infant mortality rate among low-income African-American women of childbearing age. And as a special note, Pitt County has a long history of infant mortality rates that are higher than the state of North Carolina's rates. Pitt County's African-American infant mortality rates are historically 2 to 3 times higher than Pitt County's Caucasian infant mortality rates. And as a review of the statistics for the year of 2014, because those are the most recent statistics that we have for infant deaths. In North Carolina, we had 7.1 infant deaths per 1,000 live births. And in Pitt County, we had 13.2 infant deaths per 1,000 live births. And the Pitt County rate does include 28 babies with one set of twins. and the Pitt County rate increased from 9.9 infant deaths per 1,000 live births in 2013. And for a breakdown of those rates, the white non-Hispanic for North Carolina, we had 5.1 infant deaths per 1,000 live births, and then in Pitt County, 9.3 infant deaths per 1,000 live births. The African American non-Hispanic rate for North Carolina was 12.8 infant deaths per 1,000 live births, and then Pitt County had 16.7 infant deaths per 1,000 live births. The Hispanic rate for North Carolina was 6.2 infant deaths per 1,000 live births. Pitt County had 15.7 infant deaths for 1,000 live births. And then other non-Hispanic for North Carolina was 4 per 1,000 live births, and Pitt County's was 17.2 for 1,000 live births. And just as a special note on this too, that rate is not very reliable because of the small numbers that are reported. We have several activities that are currently working to improve infant mortality rates, and then one of those is PIMPAC, or Pitt Infant Mortality Prevention Advisory Council, which will continue to direct infant mortality reduction strategies in the community. This advisory council is the oldest local infant mortality prevention advisory council in the state and is comprised of 80 to 100 members. We also have the North Carolina Healthy Beginnings Program, and that is an ongoing state grant, and that funds the Resource Mothers Program, which provides one-on-one outreach and case management for at-risk and hard-to-reach populations. Since 1994, the Healthy Beginnings Program has successfully provided outreach and counseling services to high-risk African American pregnant women in North Carolina, including Pitt County. In Pitt County, the birth outcomes of women enrolled in this program have been positive. We've seen low infant mortality, decreased preterm birth, and increased birth weights. The Nurse Family Partnership Program is an evidence-based nurse home visitation program that works with first-time, low-income parents and their children to improve birth outcomes. That program is supported by ongoing grants from the Duke Endowment, the Kate B. Reynolds Charitable Trust, the North Carolina Division of Public Health, the North Carolina Partnership for Children, Prevent Child Abuse North Carolina, the Blue Cross Blue Shield of North Carolina Foundation, and Vidant Medical Center Community Benefits Foundation, and other grants such as Woman to Woman and United Way. The North Carolina Healthy Start Program is also an ongoing state grant funded by HRSA. That's where outreach workers locate, identify women who are lost to care in areas such as family planning and prenatal care, and link them into services. The Healthy Start program also helps by removing barriers to care, such as with issues with transportation that prevent hard-to-reach women from receiving health and human services. The Breastfeeding Peer Support Program is supported by ongoing state funding and Vidant Medical Center Foundation grants. Peer support increases breastfeeding initiation and duration. We hope to continue to secure grant funding to support the in-home breastfeeding support program. Breastfeeding support provided in the person's home after hospital discharge. We also aim to continue breastfeeding classes and support groups. Preconception health awareness, and that is also an ongoing program. That's reproductive planning, improved lifestyle, and chronic disease prevention and management across the lifespan. It has a positive impact on future birth outcomes. We hope to continue to offer reproductive life planning education and service linkage among local businesses that employ women of childbearing age. We also hope to continue to offer reproductive life planning education and service linkage to community groups such as Strive, Support and Training Result in Valuable Employment, and the Walter B. Jones Perinatal Program. Tobacco cessation counseling. The plan is to train staff to become certified tobacco treatment specialists who can serve pregnant and postpartum women who are smokers. We also hope to promote Text for Baby among healthcare providers and patients. We hope to secure funds to reinstate baby bucks, which were incentives that encourage women and families to get regular health care. We hope to secure funds to continue support of the Cribs for Kids program to promote safe sleep environments. We also want to increase accessibility to long-acting reversible contraceptives to prevent unintended pregnancies. And we also want to explore the expansion of the Triple P Positive Parenting Program to include babies with their Triple P for Babies program.
Okay, our next speaker is Allison Swart.
Good evening. I am going to talk to you tonight about Tobacco Prevention and Control Action Plan. So I'm going to start off with a few statistics just to sort of remind you where we are. And I'm always surprised by the first. I probably shouldn't be anymore. But smoking is still the '1 cause of preventable death in the United States. And in Eastern North Carolina, just over 5 adults report that they are current smokers. That is pretty close in line with the North Carolina percentage, which is 20.2, but it is considerably higher than the national percentage, which is 16.8. So we still have some work to do. Although it is good to see that our rates have dropped by about 3% from 2011 to 2013. So many policies have been put in place to support restrictions for smoking. One of the most notable is the restaurant and bars law. I'm sure that you all are familiar with that. And through policy implementation, Pitt County plans to continue to address the dangers of secondhand smoke in public places beyond bars and restaurants. So our first goal is to increase by 10% the number of multi-unit housing structures that are smoke-free to decrease the number of individuals exposed to secondhand smoke. And according to U.S. Census data, 33.5% of Pitt County residents were living in multi-unit housing structures from 2009 to 2013. We plan to reach this goal through the following strategies. We plan to partner with public housing authority officials and provide technical assistance to help them implement smoke-free multi-unit housing policies. We plan to provide education to landlords, owners, and managers regarding the effects of secondhand smoke. And we plan to provide education to tenants regarding the effects of secondhand smoke and link them with cessation resources. Our second goal is to increase by 10% the percentage of smoke-free or tobacco-free public places in Pitt County in addition to the multi-unit housing that are routinely utilized by children and their families. We plan to accomplish this by establishing a regional coalition to address and implement tobacco prevention and control strategies. We plan to continue supporting municipalities that have expressed interest in reducing tobacco in public parks to help them write and implement policies. And we also plan to partner with public transportation to help with policy adoption and implementation. Additionally, we plan to increase community awareness of the danger of tobacco use through community presentations and participation in events such as Kick Butts Day. We plan to increase media coverage regarding the dangers of tobacco, including electronic nicotine delivery systems, so that's the e-cigarettes. And we also plan to increase the public service announcements, newspapers, letter to the editor, editorials, and social media messages. That's all I have for tobacco.
While we're switching speakers, anybody have any questions? All right, thank you.
I
Yes,
would like to ask a question about under the maternal and child health, if we can go back to that. It is mentioned that it looks at the mortality rate among low-income African Americans. I was wondering why it was just limited to that and not Hispanics, because we have so many more Hispanics in our community now.
Dix, I can answer that. Actually, we look at whether the numbers, the rate, and the rate is highest. It's 2 to 3 times higher among our African-American population. It always has been in our county. And a lot of our state dollars that we get from our state grants are minority grants, because that is where the problem is, and so that's why we target that area. Thank you.
Thank you.
Okay, and Kimberly Hardy is going to be our third presenter tonight on sexually transmitted disease prevention.
Good evening. Our focus for the sexually transmitted disease action plan is focusing on chlamydia. As you all have heard us report in August when we give our city report, chlamydia is a sexually transmitted disease that may lead to infertility and other complications. Eastern North Carolina maintains the highest rates of chlamydia across the state. The rate of chlamydia among females in Eastern North Carolina is over 3.5 times higher than the rate for males. In regards to age groups, the highest rates in Eastern North Carolina are among 20 to 24-year-olds, followed by 15 to 19-year-olds and 25 to 29-year-olds. African Americans in Eastern North Carolina have the highest rates of chlamydia. The numbers of chlamydia cases in Pitt County have fallen by approximately 10% since 2011. So our current goal is actually going to remain our goal for the next 3 years. Our goal is to reduce Pitt County's rate of chlamydia by an additional 10%. We have done quite a bit of work in our agency, increasing access to care by offering walk-in clinics. So we hope to expand the walk-in clinics, but we do have a bit of a limitation right now with our current staffing shortage. This slide shows you the number of STD screenings that have been provided since 2009, approximately over the last 5 years. Our walk-in clinics were implemented in 2013-14, so you can see a dip in our graph at 2012 with a screening number of 2,148 screens. If you will recall, back in 2012, that was when we had a reduction in staff. The reduction in staff led to a reduction in services. So that number reflects that change in our capacity to serve the community. The increase that you see in 2013 is directly related to the implementation of the walk-in clinics. I'm showing you this graph here to kind of show you the number of enhanced role nurses that we've had providing these screenings over the years. Again, I mentioned in 2012 we had a decrease in our screens due to our staffing shortage, and that was roughly a 38% negative service delivery. From 2012 to 2015, we've actually had an increase in screenings by about 85%. So, some of the strategies that we need to implement to allow us to further enhance our STD service delivery include the implementation of electronic health records that would help us to connect with our partners in the community with Fident and be able to treat our patients in a more timely and efficient manner. We also need to explore grant funding to reinstate a health educator who can provide community education to high-risk community groups. Our previous grant ended that provided that service. We also need to explore grant funds to reinstate condom distribution sites in the community, such as barbershops and other sites. We had this previously, and again, the funding for that service ended. Any questions?
Does anybody have any questions for Kimberly? Let me just comment that at Vinet, we're working hard to ensure that patients we diagnose in the emergency department and clinics improve our communication with the health department so those folks are followed up properly and everything. So, thank you.
I would like to just comment too, Mr. Chairman. She put a slide up there about the enhanced role registered nurses. We've got a lot of nursing students here in our audience tonight. Those nurses actually are able to do services that most registered nurses cannot do, and that's a special provision under North Carolina law that lets public health nurses do things that other nurses can't do. We are very short-staffed now. As you know, there's a national nursing shortage, so I'm glad to see some of these nurses in school and graduating soon. I hope they will consider coming to work for public health departments. I think as you can talk to Kimberly and our other nurses on staff, public health offers. Deborah Herring, also our nursing director, is there. She serves on our North Carolina board for nursing. Public health nursing is an exciting, interesting, unique field. A lot of nurses, unfortunately, coming out of school don't get enough experience in public health. But we would love to tell you more about enhanced role registered nurses if you are interested. Also, I just mentioned the electronic health record that Kimberly mentioned. We are struggling right now with difficulty getting information through electronic health records that we need to actually provide appropriate services for sexually transmitted diseases. So I'm hoping that we will have very soon have a resolution to being able to access that information again, particularly from Vidant Medical Center.
Very good. Does Amy have a wrap-up for us here?
I do. Next steps for our action plans, which will require something on your part as far as letting us know if you accept these. So if you do approve these proposed plans tonight, what we'll do after that is establish a timeline for each of the health priority action items, which will be over the next 3 years. And then we have specific forms that we are required by the state health department to complete and send in that outline what we plan to do. And those forms are due to the state by March the 7th of this year. And then, of course, we'll implement those action plan items. And then as far as the reporting, each of you probably remember me coming and reporting about the State of the County Health Report each year, better known as SOCH. That is how we report to the state what we're doing to implement the plans each year. That will be our timeline. So that concludes our plan presentation. So especially for the community, if there's any questions or if anybody wants to know more about our process or how they can get involved with working with our action plans to help us implement those, we would greatly entertain that. And my contact information is on the screen.
So we need to go ahead and approve this, the plans as submitted.
Yes,
Okay. So any
Move to
questions?
approve.
Move to approve. Is there a second?
Second.
Any further discussion? Okay, all in favor say aye.
Aye.
Any opposed? Motion passes. We thank you very much for all your efforts.
Thank you.
thank you, Amy.
Okay, is there any other old business? Hearing none, the next item is under new business, records retention schedule. John Reed.
Thank you, Mr. Chairman. This is really a bit of housekeeping. This is the current records retention schedule for health departments issued by the state of North Carolina, and that is what Pitt County operates under. It has been approved previously by this board back in probably 2008. There's been just 3 changes since then, and just as a housekeeping, I need this board to approve those changes. And then I'll take your approval to the Board of Commissioners for approval. But very quickly, the first one deals with employee eligibility records, and it really just says we have to, it's a mandatory retention throughout the employment of the employee. It used to be you could actually destroy the records while the employee was still employed after a certain period of years, which really didn't make much sense. So, the next one is patient clinical records. It really, we now need to retain those records for 11 years versus 10 years, or until, if it's a pediatric patient, until they reach 30 years of age. Used to be 28 years of age. And the third one was when to destroy a negative tuberculosis test. Prior to this change, you had to hold them forever, and that didn't make any sense. So they're asking to change that. So those are the 3 changes, and I have some documents, Mr. Chairman, for your signature if this board approves these.
Let me ask you a question about the TV records. You say previously they were held
The
indefinitely,
positives
or-
were held for practically ever,
Right.
and it never distinguished, well, what do you do with the negative test? So they just wanted to throw the negative test in. It really has no value after a year.
I'm just sort of brainstorming here, but I'm wondering if, you know, someone goes to work for an area that requires PPDs and they do have a positive, would it be helpful to be able to go back and check with y'all and say, you know, to show that this was a recent converter or?
And we do retain the positives for those.
But even the negatives.
Yeah, I'm wondering about the
Even
negatives.
the negatives
Yeah.
would be good to, I'm wondering, we actually could hold them longer though, couldn't we, John?
This is the minimum.
Yeah.
We could hold them forever.
Okay.
Yeah, I think we would hang on to those for 3-5 years at least, probably.
And we certainly are now.
We're archiving our records at 3 years,
Right.
so we could do it at that point. That would be helpful, wouldn't it?
Okay. Would you like to bring that back later, or do you want to go ahead?
Well, this would be a minimum,
Minimum. Okay.
so I think you could go ahead and approve this. so.
Okay. Does anybody have any other questions about any of the other recommendations? Is there a motion to approve, or,
Move to approve.
okay. Is there a second? Second. Any further discussion? All in favor say aye. Aye. Any opposed? All right, John, we appreciate these are all approved then. so. With that one change. Okay, the next will be the Health Director's report. Dr. Morrow?
Thank you, Mr. Chairman. Here's your- Oh, there you go. Okay. All right. Mr. Chairman, I know most of our, I'm sure the board members and most of our audience have heard something about Zika virus. We're getting information daily from the CDC and updates we've just gotten this week. So I thought it would be a good time to talk a little bit about this and answer any questions that you might have. Zika virus is a mosquito-borne disease primarily transmitted by the bite of an Aedes-type mosquito. Only about out of 5 infected people actually become ill. So this is not a severe illness. So people are sometimes worried that they're going to get real sick. This is not a disease that makes people real sick. The concern is that it has other effects on particularly pregnant women. The illness occurs about 3 to 12 days after the mosquito bite and lasts up to about 7 days, but usually causes a mild illness, which can include low-grade fever, headache, a rash, body aches, and red eyes. It may, however, cause severe problems for the unborn children, and I underline may there because the data is still new on the incidence of microcephaly, which is a small head on the baby, and changes in the brain that occur in the fetus as the brain is developing that results in the small head or microcephaly. So there's an association right now between this virus and this disease, or these results in the infants, but there's not been proven that this is the cause of that problem. So I want to make sure people are clear on that. We may find there's something else that's caused these children to have these effects. There is no current vaccine to prevent this disease, and there is no current treatment to cure it. So it's symptomatic treatment for those who do get sick. The virus has spread rapidly. It started in Africa, in Asia, and came into the Americas last year, and has spread rapidly in South America, particularly Brazil, where it was picked up on, and in Central America, and now in the Caribbean islands. The same Aedes-type mosquito also carries dengue fever and chikungunya, which has also been in the news in the last year. The news this week from the CDC is that sexual transmission of this virus is possible from infected men to their partners via semen. There is no current evidence that women can also transmit this virus sexually. Sexual transmission is a concern for pregnant women because of the impact on the fetus. And it is good news that consistent and correct use of latex condoms reduces the risk of this sexual transmission as well as many other diseases. This is a map of the current status of Zika in the purple. You can see a good chunk of South America is affected, as well as Central America and Mexico. And it's really small on here, but you can see the Caribbean islands, particularly the Dominican Republic and Haiti, Jamaica, Martinique, or St. Martin is included in that, and the U.S. Virgin Islands as well. So what do? Right now, we're advising that pregnant women should consider postponing travel to Zika-affected areas because of the risk of being bitten by the Aedes mosquito that can transmit this virus to their unborn child. Pregnant women who have already traveled to Zika-affected areas should consult with their healthcare providers about further evaluation and possible testing. You can do blood tests to test for the virus or the infection, and you can also do ultrasounds, serial ultrasounds, to look at the development of the fetus to make sure that that's normal, looking for microcephaly or calcifications in the brain matter. Men who have traveled to these areas should avoid sexual contact with potentially pregnant women. So that includes the use of condoms. This is just showing you an algorithm for the guidance for testing for pregnant women with a history of travel. It's probably too small for you to see most of this, but the CDC is providing this information, and we're forwarding this information out to clinicians who are seeing patients every day who, as you can imagine, we've got a lot of people this time of year who are traveling to the Caribbean or to Mexico for vacations. So that's where a lot of the concern is coming here locally, at least. The other concern that we have is that the Aedes mosquito is actually already in the United States and has been here for a while now. This is the distribution. On the left is the Aedes aegypti mosquito, which is the one that's currently transmitting this virus in Latin America. And on the right side is Aedes albopictus, which you can see we're just on the border of having the Aedes aegypti on the left there. That's into South Carolina, Georgia, Florida, and those southern states. But we were already covered up by the Aedes albopictus, which you can find right here in Pitt County. So both of these mosquitoes, being Aedes species, we think can carry, we know they carry dengue, yellow fever, chikungunya, and now potentially could carry Zika. So this is a statement from the CDC. Any travelers visiting or returning to parts of the United States with established populations of Aedes aegypti or Aedes albopictus mosquitoes could initiate local virus transmission. Now, we saw this happen just last year or the year before with chikungunya in Florida, where people went south, got infected, brought it back to Florida. The local Aedes mosquitoes in Florida then bit those people and then transmitted it to other people. So there have been 11 cases, I think, in Florida, endemic cases. That's not happened here in North Carolina yet, but there's the risk that that can happen. So let's talk a little bit about the Aedes mosquito. It spread initially through tires and other water containers. Tires are very difficult to get water out of if they get water in them. If you've ever tried to get the water out of a tire, it's very hard to do. And so they breed mosquitoes in that water. These are container breeders, so they actually traveled throughout the United States, probably in tires via the interstate highways. And you could watch the spread of this mosquito through these states right next to interstate highways a few years ago. These are container breeders, so anything that holds water will breed these mosquitoes, and that includes a bottle cap, a plastic chip bag that's laying in the bushes that's holding water, anything that'll hold a little bit of water for a week. The mosquito can lay an egg in, and we will have adult mosquitoes pretty soon. These are aggressive daytime biting mosquitoes, so these are not the ones that just come out after the sun goes down. These are in the backyard and in the front yard and in the side yard. Anywhere there's water, or if there's water in your neighborhood. These mosquitoes don't travel, some mosquitoes will travel miles from a swamp area to come bite people. These don't travel that far. They just go a couple of blocks. So these are your backyard mosquitoes that are being bred right in our own neighborhoods, and then they're biting during the day. As I mentioned, the life cycle from egg to an adult takes about 10 days. And with all the water we've got right now, as the Tar River is evident of standing water, most of our backyards are still have puddles and water, so if that water stands for 10 days, we can have mosquitoes. The bottom line, I think, in terms of preventing infection is avoiding mosquito bites, and we talked a little bit about that last month, but anyone that's going on vacation to a Zika infected or chikungunya or dengue infected area, the Caribbean for instance, needs to avoid mosquito bites and take that risk seriously. So in our own yards, we need to tip and toss the containers, use larvicides or dunks where water stands. You can get those larvicides at many retail places here like Lowe's Hardware and other places that sell these larvicide dunks. Use screens on doors and windows, wear long sleeves, pants and hats, avoid morning and evening exposure, and use of mosquito repellents that include DEET, picaridine, OLA, which is oil of lemon eucalyptus, it's a natural thing, and then the IR 3535 is another ingredient that some people may not be familiar with, but the Skin So Soft, some people have used that product for years as a mosquito repellent. That's the ingredient in Skin So Soft that's a mosquito repellent. And it is, all these actually are safe for pregnant women to use. And I think that's important for people to understand that you can use DEET, you can use these mosquito repellents even if you're pregnant, and you can use them on small children above, I think, age 2 months.
I was just saying, I didn't know if there was a % of the DEET for small children that you shouldn't go over, or was that a?
I don't know, but I can find that out for you. I think you're right, there is a %, but I think the products are listed that way, so I don't think they go over that for children. And the last thing I mentioned here is just supporting public health mosquito control programs. We are very fortunate. We do have mosquito control in Pitt County. There aren't but a handful of counties, well, it's more than a handful, I think there's in the teens now, but most of those counties are on the coast that have mosquito control programs. We have one employee, Jim Gardner, who is our mosquito control program for the county. He gets some help from some of the municipalities in terms of doing some spraying usually in the summer months when all the complaints are coming out. But Mr. Gardner is the one who actually identifies these mosquitoes, and he's working hard to make sure that we find the Aedes albopictus, find out and try to educate people, particularly about how these mosquitoes are bred in their own yards and how to prevent these things from biting their children or loved ones. I think, you know, if people look back in the history book and see it hasn't been that long since we had malaria in North Carolina and since we had yellow fever. Many people may not realize it, but many of the people we lost in the Civil War in North Carolina did not die from bullets. They died from yellow fever and malaria. Terrible outbreak in Wilmington in 1863, I believe it was, that took out about a third of the population, I think, of Wilmington at that time. So these diseases have been suppressed, but given the right conditions, just like we've seen a resurgence with tuberculosis, we can see yellow fever again here in North Carolina. And these other new diseases like Zika virus that are emerging. So we've got to be able to control mosquito populations, and we've got to have an educated populace that knows how to prevent transmission of these infections, because you know, once you have the mosquitoes and you have the disease, it's pretty hard to control after that point. So. Questions?
I have one.
Yes, sir.
Dr. Morrow, you did you explain a lot of things, but you didn't say if somebody does have it, does
Yes.
the body eventually fight it off and eradicate it? And
Yes.
how long does that take?
Just about a week. So it's a mild infection for people that actually get infected. Only about 20% even get sick.
That's the sickness, but can they continue to pass it on beyond that?
No. So once they get infected, it's like a lot of our viral infections. Your body makes antibodies against that virus and kills the virus, and it's out of the body in a week or 10 days.
Is there any thought of bringing back DDT on a temporary basis? Because it has been largely debunked that it was not nearly as bad as what it was claimed to be.
I don't know the answer to that question. I know there have been I've heard comments about, do we need to bring DDT back? I know in Africa, the control of malaria, they've done an excellent job with the dispensing of mosquito netting in terms of controlling malaria outbreaks in Africa. It's a huge decrease in malaria transmission as a result of that. So, but I don't know where they are with the thought of using DDT or other types of chemicals like DDT in place of what we currently have.
That's all. Thank you.
If I could just comment, there was an article in the New York Times. Were you going to comment on that? Or?
Go ahead. No. I was
Yeah, there's an
going
article in the New York
something else.
Times, not this past Sunday, but the week before, that there was a mention of that possibility that maybe, you know, the birds wouldn't like it because it's toxic to young birds and all, but there was a mention about we may need, you know, that strategy to bring it back in some form. So
I think down in Brazil, they particularly concerned because of the Olympics this coming year, and I think they had pretty much eradicated, I think, was it this mosquito they had pretty much eradicated. The World Health Organization had pretty much spent a lot of time and money and had eradicated it, and then now I believe this all has come back in full force, and the officials in Brazil are pretty much admitting defeat at ever getting control of the mosquito population. Or I believe that was the article I was reading. It was pretty much they were not convinced that they could do anything to get a grip on it. So I don't know, maybe they would need some outside help with something to kill the mosquitoes to ever get a control of this problem, given the environment that they have to work with. But
I have heard that on NPR that there is a possible association with some neurological disorders, like Guillain-Barré has been
Correct.
reported.
There
But
is.
that has not been proved, I guess, just
Right.
like the other. Microcephaly has not been absolutely proved.
Correct. I think that's true.
Okay.
There is an association with Guillain-Barré syndrome. I think, you know, maybe the best answer in terms of correcting the problem is actually a vaccine. Because mosquito control is, like you say, particularly in rural areas, it's very difficult to actually control mosquitoes. So.
I think you know, we were concerned with chikungunya that showed up in summer of, 15. We had some cases, as you mentioned, came back from other parts of the Caribbean, and it really, to our knowledge, has not spread, you know, as much as maybe we thought it would. Now, I think we're still waiting on a lot of epidemiology on that, so it's going to take a big effort, so we appreciate you going over that. It's good to inform the public. Anybody have any other questions for Dr. Morrow? You want to continue with your report from there, or?
That's my report.
That's your report, okay. Okay, is there any other business tonight? Hearing none, is there a motion to adjourn?
So move.
Is there a second?
Second.
All in favor, say aye. Aye. Any opposed? All right, the meeting is adjourned. Thank you very much.